Hi, I'm Dr. Martin Rutherford. I am a board-certified chiropractic physician since 1979, and I'm a certified functional medicine practitioner, which is more pertinent to what we're going to be talking about today, for those of you who've never seen this.
Dr. Randall Gates, board-certified chiropractic neurologist, as well as being a chiropractor.
And again, if there's folks that are new to what we're doing, here we're trying to maybe bring some focus and some light to a lot of the controversial areas or the uncertain areas of chronic pain. We feel that we're competent to do that because this is what we do. We didn't set out to do that. As chiropractors, we have a wide background in musculoskeletal problems, but a lot of people don't know we also get quite a bit of education in nutrition, diagnosis, and ultimately chronic problems, chronic pain end up being a combination of brain issues, which we're going to talk about extensively today, endocrine and what we call metabolic issues, which really seems to be coming down to the endocrine and the immune system, your hormones and your immune system, and musculoskeletal problems, which is why so many chiropractors are in this. A lot of people come in with fibromyalgia, which we're going to talk about today, and you got to figure out which one of those things are really playing together to create that person's pain. And we're going to do post-traumatic stress syndrome and its role in fibromyalgia. And I'm kind of anxious to do this one because we had somebody kind of ragging on us a couple of weeks ago about fibromyalgia. And we had the opportunity to go and investigate that person's website, and they put some good stuff on there. But in essence, what we're trying to do here is exactly what I found when I looked at that website. I mean, I thought that website just created an enormous amount of confusion. The website says there's no such thing as fibromyalgia. Chiropractors are idiots. They don't know what to do. They have one solution for everything, blah, blah, blah. I mean, these are things we've heard forever, okay? And
they called our office and asked what we did, and our front desk gal.
Well, she was in the middle of doing 6 things,
right,
and couldn't answer the phone because I happened to be standing right there when you called, if you're watching this. And yeah. And they said that our relaxation program, which we're going to talk about today with the post-traumatic stress syndrome, entails putting people's feet in foot baths, and I forget what else. But my gal, I was standing right there wondering what was going on because she was very confused. She didn't want to answer the phone. She was trying to be polite. Anyway, the bottom line is fibromyalgia exists, okay?
Oh, yeah.
And that person seems to think it doesn't. For those of you who have it, and I am one of those, you know it exists. I think the confusion, and I think this lady's position is fibromyalgia doesn't exist. There's no such thing as pain in your muscle fibers, and it's a dumb term, and we would agree with that. It is a dumb term.
Absolutely.
And that's what it's a big part of what we're going to talk about today. But if that person has watched anything that we have said on fibromyalgia, we are about to define it again. Mm-hmm. And we have always said fibromyalgia is a poor term. However, it is the term that the American College of Rheumatology uses in its guidelines of 1990 and 2010 mm-hmm. to define what creates these pains. Fibromyalgia will first define the term. I'll let you define it, and because I know how I would define it. But we're going to talk about today. We're going to talk about post-traumatic stress syndrome and its role in fibromyalgia, and that is one of the things that's in there. But fibromyalgia means pain in the muscle fibers. Mm-hmm. It is not pain in the muscle fibers, okay? But it is pain, and it is brain fog, and it is memory loss, and it is pain that comes and goes, and it is gut problems, and it is misdiagnosed thyroid problems, and it's the post-traumatic and the stress. And so all these things put together that create a pain presentation that has been poorly termed. But we use the term because that is the accepted term that we need to use just simply to communicate. Okay, so for those of you who may have, and we've had a few people who may have become aware of that whole thing. It's not why we're doing this today, but I took the opportunity to kind of address that, because one of the biggest problems, one of the biggest things I see when a patient comes into me and they're doing a consult, I'm sitting there and I say, oh yeah, okay, so you have fibromyalgia. And I go, let's see if you really have it. And then they go through the steps and go, wow, you really got it. And they relax, because it's like, okay, somebody doesn't think I'm crazy. Then I go on to define what it actually is and how that's a poor term, and we're going to do that right now. So let's do that first. Let's define what fibromyalgia is for all the people who are new, for the people who have been watching, and for Ms. Brain Dead out there who used this disingenuously. And I'm letting you know that that was not okay. So there. I didn't tell him I was going to do this because he probably would have freaked out. So
yes. So in diagnosing or defining fibromyalgia, the 1990 criteria was such that at that point, rheumatologists saw this wide group of patients where they had pain all over their body. They couldn't sleep, they couldn't think, they had brain fog, but they didn't have rheumatoid arthritis, they didn't have lupus, they didn't have other what are termed autoimmune diseases or connective tissue diseases to explain those symptoms. So at that point, they noticed that these people were really sensitive to touch. And so they came up with the aldometry exam where they poke around and there's 18 points. If you're tender at 11 out of the 18, then you have fibromyalgia. That's what they
And
knew.
as I say to patients, if you have fibromyalgia, you're probably tender in 110 out of points on your body.
Right, exactly.
So it was a poor diagnostic tool.
And at that point, fibromyalgia was a diagnosis of exclusion. Meaning, if you have this pain, but you don't have rheumatoid arthritis, then you probably have fibromyalgia.
Meaning, if they couldn't figure out what was wrong with you,
then you have fibromyalgia. Unfortunately, a lot of physicians still use that phrase, even though the gold standard textbooks in rheumatology say that that is completely inaccurate to use that phrase, because we now know over the last 25 years an immense amount about fibromyalgia.
Yes.
We know, we can't even go on and on about how much we know because we've done it in other broadcasts and those.
And all of those broadcasts have numerous peer-reviewed references attached to them to show you that the science is even there. Okay, the only thing that's not there is the drugs that can fix it, but the science is massively there.
Exactly. So we know with fibromyalgia patients, for example, that they don't filter pain and sensory input from their body well. So I don't feel the shirt on my back. Do you feel the shirt on your back? Probably not.
No.
Whereas a lot of fibromyalgia patients, a lot of fibromyalgia patients do. We know that a lot of fibromyalgia patients, just in the last couple of years now, I guess it's 2015 at this point, about 40% have small fiber peripheral neuropathy, which is where the pain nerves are dying and degenerating. And this is a really hot new topic. You got to be on the new literature where they're saying this could be a driving mechanism of the pain because the nerve fibers are dying, the pain that a fibromyalgia patient experiences. We also know that a host of fibromyalgia patients have autoimmune diseases, not rheumatoid arthritis, but a lot of them have autoimmune thyroid problems where the immune system is killing the thyroid. A lot of them have gluten issues.
I can hardly remember a fibromyalgia patient coming in here, and we've been doing this for years now, who did not have an autoimmune attack on their thyroid.
Exactly.
I'm sure there must have been a couple, but not many.
Right.
And that's called Hashimoto's.
Yes. And then stress.
You started talking about gluten sensitivity.
Gluten sensitivity. We did a whole broadcast on gluten sensitivity where it was Rheumatology International, I think in November of last year. They took 20 fibromyalgia patients, they put them on a gluten-free diet. And by the end of the study, in about 6 months or 8 months, all of them had significantly improved in terms of their pain. They were off medications. They were sleeping better. 20 out of 20, that's pretty staggering. And so now they're doing a large scale study, I think with about 300 people to follow up on that initial study. And then there is stress. What we're going into today is PTSD and fibromyalgia. The reason being is that you've heard the histories, I've heard the histories. It is nauseating to hear the histories of what so many of the patients coming in here with fibromyalgia have experienced. And the literature definitively substantiates that those childhood abuses that people have been through are driving mechanisms for someone to have pain throughout their body that we put a label on of fibromyalgia. And hopefully by the end of this, you understand the underlying mechanisms as to why that does happen.
Yeah. So the definition in our world, the actual definition of fibromyalgia should not be pain in the muscle. Fibromyalgia should not even be a term because that means pain in your muscle fibers. It's technically, once the patient kind of relaxes, we can say, well, your doctor said it was in your head, and it kind of is in your head because your head isn't filtering out pain, correct?
Right.
The way it should be. So that's a neurological component. And this post-traumatic stress syndrome that we're going to talk about is a big reason why. It is, and then, so fibromyalgia is having that post-traumatic stress syndrome. We can call it an overactive fight-flight syndrome. That's a big part of it, big part of it. Usually a person has an autoimmune attack, and that autoimmune attack is frequently on their thyroid and or their intestines. That's fibromyalgia. Those components are what come together to create this pain pattern that we now use an inappropriate term for, but we'll continue to use that term because that is the term in the literature. That is the term you have been that you have been schooled on, and that is, it makes it easier for us to communicate on this. And this post-traumatic stress syndrome, I would argue, is the hardest part of fibromyalgia to address. As you said, there's studies that showed just getting off the gluten, everybody showed some, in that particular study, everybody showed some degree of improvement. So, so that's kind of the metabolic aspect of fibromyalgia. A lot of fibromyalgia patients come in here and I got neck pain, I got back pain, I got low back pain. We're chiropractors, they want to get adjusted. We won't even adjust them, right, until all of this is taken care of, because a lot of times their neck and their back pain goes away without adjustment. And we're chiropractors. I mean, we use our hands to adjust people, not so much anymore, but we do have chiropractors in our office that do strictly chiropractic. And we still do not include that in our treatment protocol until we see what happens once their brain is calmed down and once their system is calmed down. So that's fibromyalgia. However you want to argue with that term, have at it, okay? But it's the brain, it's the autoimmune problem, and then relative to that autoimmune problem, I would even go one step further and say it's usually the gut, it's usually the thyroid that gets attacked, the gut that gets, and the cerebellum a lot of times. So those of you who get kind of dizziness and balance problems out of nowhere, and you're kind of going like, now what? It's all part of the same thing. So let's talk about post-traumatic stress syndrome. So, and it's what you said, it's sexual abuse, physical abuse, verbal abuse. Don't you think it's also maybe like a long-term stress can do it like I had? Kind of stumping for myself. I wasn't physically or sexually or verbally abused, but I did have some major stress around the time I developed what was going on. Right. Yeah. Exactly.
Yeah. So let's talk about that. I'll read an excerpt from this is The Principles of Neuroscience. It's chapter 61, written by Eric Kandel, who is the father of neuroplasticity. He's the man that basically discovered that our brain can change, and we can do exercises and things like that to change the brain and how it works. And he said, PTSD is an extremely stressful event that manifests in recurrent episodes of fear, often triggered by reminders of the initial trauma, and the memory for the traumatic experience remains powerful for decades. And so, as Dr. Rutherford was saying, lots of times it can be one episode of abuse. However, or somebody's in a war experience, and we've seen a lot of these poor guys who've been through horrific circumstances that maybe lasted an hour.
And I would argue those are the worst for those of you who don't know. Yeah. When you hear about these guys coming back with this post-traumatic stress syndrome, being disabled, and you think that's not real or they're faking it, let me tell you, they ain't faking it.
They are not faking it. No. It is horrific. The stories that we've just, it's almost hard to hear the stories. I can't imagine them reliving the memories on a daily basis. However, relative to PTSD, what we've seen is, lots of times people have been through recurrent stresses, long-term stresses. We have a lot of patients who have experienced abuse in childhood over a long period of time. So it wasn't just one time, it was for like decades or years. Yeah. On end, and those traumatic experiences get formed in the brain, and the brain becomes fixated on them, and it can't forget them. And there are other circumstances, frankly, where people do forget them. We just had a case of this last week. One of our patients, she had been through horrible childhood abuse, and she had actually blocked out the memory. And then she had been through counseling, and then all of a sudden it came back all of a sudden, and she really had a meltdown. And so that it can go either way. That's the point of the story. And so PTSD is associated with really high levels of stress hormones. That's why it's really.
So when you get this post-traumatic stress syndrome, some people prefer sympathetic dominance because it's some part of your autoimmune system, your immune system, not autoimmune system,
Autonomic.
your autonomic nervous system. And some people prefer a chronic fight-flight syndrome. Basically, your brain is supposed to go into this. It's really a survival mechanism. It's supposed to go into this fight-flight pattern just briefly. Like sometimes just for seconds. Sometimes there's a loud noise, you go like this, and you're in that fight-flight syndrome for a few seconds until your heart stops pounding and so on and so forth. Or you can go into it for 5 or 10 or 15 minutes. They theorize that the person, one of our ancient colleagues, would come up against a tiger and have to either decide to fight or flee, but this mechanism puts you in a position to do so. So it starts pumping blood out to your muscles and blood sugar out to your muscles. And a lot of people who have these stress syndromes they get urinary tract infections, and they wonder why. And it's because a stress mechanism shuts their ability to pee down, because you don't need to pee while you're fleeing or fighting. So it shuts down your ability to move your bowels, shuts down your ability to urinate, gets your eyes really big, gets your heart really pumping. And now you become Superman or Superwoman. You see a kid under a car, you lift the car up, the kid gets out from the car, you drop it, everybody looks around and goes, how did that happen? This is how that happened.
Exactly.
Except to you, if you're a fibromyalgia patient, you're watching this, to some degree, it's happening to you 24 hours a day.
Right.
And some of the symptoms would be like you can't go to sleep because your brain's going 1,000,000 miles an hour.
Which is a cardinal feature of fibromyalgia. They can't sleep. Dr. Teitelbaum, who we saw at the A4M conference, he's a big fibromyalgia guru. He likes to bring in, he's a medical doctor, but he loves bringing in naturopaths and chiropractors to collectively address the fibromyalgia patient. And he said, the main thing is they can't sleep. And we've seen that.
And when they wake up, if you do get to sleep, you wake up in the middle of the night, you can't go back to sleep. So that's kind of the big, I mean, there's a ton of symptoms, but that's what's happening to you. Okay, your brain is going 100 miles an hour, 24 hours a day. Sometimes it's going 25 miles an hour, but it's supposed to stop. We're supposed to be in rest and digest mode most of the time. Who's in rest or digest? That'll get to, is this just an American problem? Who's just in rest and digest a little bit at a time, and then morphs into this survival mechanism for a brief period of time and then just cuts back out. Not you. If you're watching this and you have fibromyalgia, you're not doing that. And then that creates these high levels of stress hormones, which is hugely important to discuss.
Yeah, hugely. So when we were first discussing what is termed central pain syndromes in neurology back in 2007, when I was going through my training, they discussed the effects of stress hormones binding to the pain nerves. So basically, simply, stress hormones are like lighter fluid on your pain nerves. So the more stress hormones you have, the more pain you're probably going to feel. And for a fibromyalgia patient, that's a big deal, because you're already feeling pain. It's going to cause the pain to amplify even more, or it can be the underlying mechanism as to why your pain nerves are sounding off like a firecracker when they shouldn't be. And so what we've seen with PTSD in the literature is that consistently they have higher levels of stress hormones, which is not surprising, but it is a phenomenon that needs to be acknowledged. And with that, your pain nerves start to learn the pain. And that's why estimates vary, but some say 60% of fibromyalgia patients have PTSD, or 45%. Also, 30% of Holocaust survivors have fibromyalgia. I just saw that last night. That's a really interesting statistic.
Yeah, and I can't talk to the Holocaust survivors, but I would say that there's a good chance that those numbers are going to go up as far as what percentage of people have fibromyalgia have PTSD.
Exactly.
Because we see it in everybody. It's our definition.
Almost every person that walks in.
Yeah, it's our definition. And frequently over the years, we've seen that. For example, we saw that 50% of people had peripheral neuropathy before the literature ever came out.
Exactly.
Because we do an exam head to toe. Dr. Gates does a neuro exam, and he kept saying, these people, I did.
Yeah, I was shaking my head.
I haven't. So that's pretty big. And the thing about these cortisol levels, and I'm talking again from my experience of consulting with folks before we determine whether they're a candidate for what we do or not. If you have these cortisol levels and you're not aware that this stress is a part of it, okay? And this is way beyond stress. This is not you not being able to pull up your bootstraps. This is an automatic mechanism that's going 24 hours a day, and it lowers your threshold. So you might just be a little bit more irritable. than usual, than you might think. Or you might get anxiety a little bit easier than you might think. So you need to know this is kind of an automatic mechanism, and it's really not that you're a weak person or anything like that. But these cortisol levels also seem to sabotage everything that people have tried to do since they come in. Who has gotten off of gluten, gotten better, and then gotten worse again because the cortisol levels were high and they went back and damaged their gut. Who is trying to, who has watched us or whatever and tried to figure out their thyroid and gotten off food sensitivities and fixed their gut and found out that, but they never were able to get completely better because they were not able to address this mechanism. And this cortisol level, it affects everything. It affects everything basically, but it affects your brain, it affects your left midbrain. It causes short-term memory loss. It can affect your immune system. It can continually damage your gut and the pain and on and on and on and on. Mm-hmm. So this is huge. And I just wanted to put that out there. For example, we have a stress modification program, which is more than putting people in foot baths. It's actually a fairly sophisticated program, and it has a lot of potential parts to it, depending on the person and how severe they are. But if we don't calm that down, if you don't calm that down while you're taking care of them, mm-hmm. they're not getting better because they're creating those stress hormones while we're treating them and just basically sabotaging what we're trying to do.
And I really recommend all the viewers out there
important.
Go back and watch our broadcast. I think it was a week or two ago on panic attacks and anxiety. Just because that really pertains to what we do with those patients. So basically, yes, some of our patients go through our stress modulation, but a lot of our fibromyalgia patients, we actually do neurological rehab with them, because once you develop PTSD or generalized anxiety disorder, you have a frontal lobe issue to where your frontal lobe isn't strong enough to shut off the fear centers. As a result of that, your brain just starts winding at 9,000 RPMs as an analogy, such that you just keep thinking about these stressful circumstances. And that's the cardinal feature of PTSD. You can't forget. You can't forget. And then as a consequence of that, your body doesn't forget the pain. Now, in going through how pain works in the body, I think we need to revisit that issue. Some of you have been watching all of our broadcasts on fibromyalgia, others have not. It's really important to understand how the nervous system signals pain, because we know that fibromyalgia is not a problem in your muscles. If anything, it's a problem in your nerves. So if this pen was to stab me in the hand, we have little nerve fibers there that sense pain. And so they send signals up my arm through different nerves, up to my spinal cord, and then it goes over to the opposite side of the brain, so that the brain can say, something happened here and we're receiving pain signals, so therefore it must be painful. Okay. We all of us, human beings, have mechanisms in their brain that will shut off pain. This is how they discovered morphine. Our body produces morphine basically naturally. And these chemicals come from a deep part of our brain and actually go down into our spinal cord, such that if you flick yourself, it's not interpreted as being painful. Or if you push on the hand, it's not interpreted as being painful, because the brain is actually having an analgesic effect, if that makes sense, to get rid of the pain coming from the arm. For the fibromyalgia patient, frequently that balance of the signals coming from the brain and the balance of the pain signals from the arm changes, such that now the pain signals are heightened. And so that's important for you to understand. You also need to understand, as a fibromyalgia patient, that the brain starts interpreting pain signals in an odd way and an emotional way. So if they do evoke or induce pain in somebody who doesn't have fibromyalgia, they can see certain parts of the sensory area of the brain light up. But in a fibromyalgia patient, they see the sensory and the emotional areas light up. And that's why there's a significant amount of suffering for the fibro patient. We kind of mentioned the underlying causes relative to fibro, but I think that let's just kind of revisit them in a little greater detail. Small fiber neuropathy, as Dr. Rutherford said, is where the nerves start to die and degenerate, typically in the feet. It can spread up to the knees, and then it can also involve the hands. We started seeing signs of this type of nerve dysfunction in our fibromyalgia patients 5 years ago. And as you said, I was scratching my head saying, oh, all these people have small fiber neuropathy. Am I losing it? Well,
Because
thankfully,
it wasn't in the literature.
it wasn't in the literature at that point. It wasn't acknowledged in any of the textbooks and any of the manuscripts doctors get. And so then in 2013, June is when it first appeared. It was actually officially published in November in the journal Pain, where they said about 40 to 50% of fibromyalgia patients have small fiber peripheral neuropathy. And it was like a hallelujah moment, just because it was this big sigh of relief. Okay, so there's some validation of what we've been seeing. And then these studies have since come out basically validating that initial study, showing that a significant percentage, 30 to 40 of fibromyalgia patients have small fiber neuropathy. That's very significant because if your pain nerves are dysfunctioning, you're getting a lot of pain signals flooding into your brain, and that can overwhelm the body. And therefore, if you stub your toe, what normally would just be a toe pain now is an entire leg pain, if that makes sense. Or it may spread throughout your entire body. So that's small fiber peripheral neuropathy. In the fibromyalgia patients, the immune system can cause this type of nerve dysfunction. Prediabetes can cause this type of nerve dysfunction. There's discussion about gluten, even though it's something we eat in our mouth and it goes to our gut, it can actually cause nerve dysfunction throughout the body. Watch our gluten podcast. Frequently, yeah. And so those are the underlying causes. Also, the immune inflammation. So Hashimoto's thyroiditis is a term we've thrown around a lot, and that's where the immune system kills the thyroid. And we now know that basically if you have hypothyroidism, you have about a 90 to 95% chance of having Hashimoto's thyroiditis. But then in January of 2014, in clinical rheumatology, they came out and said, you know what, a lot of these fibromyalgia patients have Hashimoto's thyroiditis. And they said, independent of what your thyroid hormone tests are, your TSH, your T4, if you have the immune count to your thyroid, that immune inflammation is basically causing you to kind of be sick all the time. And that immune inflammation causes those pain nerves we were talking about to, again, fire off like a firecracker, very analogous to the stress response that we've talked about in such a detail today. And then gluten is the new piece of the pie, so to speak. Pardon the pun, just because gluten is a tough molecule to break down. It can cause immune activation in the intestine, where the immune system is starting to attack it because it's so hard to break down, and that immune system activation can spread throughout the body and result in pain.
And really, in the end, it's a combination of this post-traumatic stress syndrome and immune problems, and the triggers. I think we didn't have that down, but I think the triggers are kind of interesting. You can have those of you who have or believe you're experiencing fibromyalgia, and this makes sense to you. The triggers usually are either going to set off one of these immune responses, or it's going to set off one of these stress responses. We see it as chiropractors. Before we got into this, we used to see it after car accidents, and then people would develop post-traumatic stress. Did it set off their immune system, or did it set off their stress mechanism, or both? You know, that stress mechanism was already there from their childhood problems and from their previous stress. Having a child, there's a lot of theories on that relative to the antibodies during time, but having a child can be stressful for somebody who's already had this post-traumatic stress syndrome in place, if you will. Overwhelming infection for me, I had pneumonia, but I was also going through a pretty high amount of stress at that time. Surgeries, big time. Man, if you have fibromyalgia, think 5 times about having any type of, I wouldn't even let them do laser on my eyes because I'm so freaked out about having anything happen to my body, because I'm feeling, you know, I feel pretty good these days. But any type of a trauma, frequently we'll hear, I had a left hip replacement. All of a sudden I have pain all over my body and my feet are burning. And out of one hip surgery, within 10 days, they've developed fibromyalgia, peripheral neuropathy. This is not in people's heads. These are traumas to the body that are setting off either this post-traumatic stress syndrome that's been underlying, or an immune problem, or both, from my observation.
Yeah, I would agree completely.
You
know, basically, one thing we've been dancing around is childhood sexual abuse is really, really common. It's something that we hear every day almost in our clinic. And the studies vary from country to country, but in essence, conservatively, they're saying now over 1 out of 5 young females and over 1 out of 10 young males have experienced this childhood sexual abuse. And it's one of the most traumatic circumstances somebody can be through. We hear these stories all the time, and they're nauseating. And so if you have fibromyalgia out there and maybe you've been through some form of abuse as a child, just know that that could be really significant to why you have this pain syndrome that nobody believes that you have, and lambast you for having fibromyalgia. Yeah, I've had the privilege to have close family members in the medical community, and the way they view fibromyalgia is basically people who are addicted to narcotics. So there are people who are drug addicts, basically, not necessarily their own fault lots of times because pain management has put them on those drugs. But they're drug addicts, and so they go to the hospital and they're in so much pain. They say they have fibromyalgia because there's no way for the doctors to say, oh, well, this lab test says you don't have fibromyalgia. They give them the pain meds. And so these people can be a burden and a bear, so to speak, for the medical doctors and the nurses to work with. And so that's a big part of the stigma about fibromyalgia that you need to realize. Whereas that's just a little sample of this huge group of people out there who actually have something wrong with them, who have been through awful things and have major autoimmune issues and digestive problems, and they can't sleep and they can't think. And so just kind of rest assured in that, in what we're saying here about PTSD.
Now it's again, it's a touchy subject. I know in the consults when a lot of people are not. I just want to make this point because a lot of people are not aware that they have this. It's amazing to me, and then I'll very gingerly kind of approach it. I'll just quietly say, you have kind of seems like you have some signs as I'm sitting here watching that person of a post-traumatic stress, and they might have a little tick or their eyes might be fluttering. These are signs of that potentially their fight-flight mechanism is engaged, and sometimes they'll be there with a significant other or a child. Mothers frequently come with their daughters and sons to the consult to have another set of ears, because fibromyalgia patients oftentimes have short-term memory loss. And so I might gingerly or just gently say, so, and so it looks like you might have this stress mechanism after we've defined that the PTSD is a big part of it. And I'll say stuff like, and it's amazing. Sometimes it's physical abuse or verbal abuse. Sometimes it's sexual abuse, and I'll watch. And if they're with someone else, a lot of times the patient isn't going to acknowledge that. A lot of times they'll look in the other direction. They might get a little tear in their eye. If they're by themselves, we have a box of tissues there because that person, they just break down. And it's a good thing because that person suddenly can start making the connection to that. And then they can start understanding that they're not really crazy. The pieces of the puzzle start to fit together. And a lot of times it's just a really cleansing kind of, they usually feel better, after they leave the consult without us having done anything. Just, it's a big release, but you need to know it's important. And it's not an easy thing to knock down because it is not you. It is not that you're weak. It is not that you have a personality disorder or that you have to buck up. This is a mechanism that's going 24 hours a day. It's the same mechanism that causes your heart to beat and your lungs to expand and contract and just runs your whole body without you even having to think about it. When it goes out of control, it starts to kind of, like you said, your frontal lobe starts to learn this behavior, and now you have to break that. And a lot of people come and say, well, should I meditate? And the answer is, if you meditated, that would be a great thing, except people whose brains are going 250 miles an hour or 9,000 RPMs kind of have a hard time meditating. So there's that double-edged sword. So there's a lot of methods to be able to calm that down, and most of them are non-drug methods. And I don't think I would be exaggerating if I said there's 100 different ways you can do it, but it's different for each person. And Dr. Gates, this is big time. This is where his area of the office is, and so we've devised kind of a general kind of a program while the patient's here, but you devise multiple strategies for them to use at home. Mm-hmm. That is going to be right for that patient. Some people can use different colored glasses depending on what the firing of their brain mechanism is. Some people can use exercises that calm down their cerebellum. For some people, those two things would fail miserably. So you have to find out what the other types, and you have a lot of different things that you do. And don't underestimate the fact that that sounds simple, because that's the point. If you have to take drugs or you have to take some sort of herbs or whatever it is, or neurotransmitters for the rest of your life, that's not as good as if you have some sort of strategy that you can do at home in a couple of minutes or at work in a couple of minutes, something to keep that under control, because it's critical, because you're putting out this cortisol, and I'm not sure, I don't know if, it's that putting out cortisol 24 hours a day is, I mean, think of somebody that you've known that's been stressed all their life. I mean, they kind of like are almost like, for lack of a better term, they're almost like shriveled up. They don't look good in every way, because that cortisol damages essentially everything. But it is a huge player in fibromyalgia. If you don't have this, you don't have fibromyalgia. Could I say that?
You can't say that, but a large
would you say that would be accurate according to the patients that we've seen?
I mean, we've seen some fibromyalgia patients who are just purely immune.
Okay, so I'll take that back.
Yeah, but the majority,
vast
I will
majority
agree,
have
this stress. And I think the 60% of fibro patients having PTSD is a low ball estimate.
I think it's low.
Yeah,
but that's still a lot.
Mm-hmm.
I'd probably say a lot higher than that. So anyway, anything else?
No, I think we covered it.
Okay. So that is PTSD and its role in fibromyalgia. I don't know if we hit it. I hope we did hit it. I tried to bring in the kind of the stuff we see every day, the thing I hear from patients, the things we see from patients. Dr. Gates hit the science very hard, and it's there. I mean, there is such a thing as fibromyalgia. This is a big, big part of it. Fibromyalgia is a bad term, but if you have the symptoms of what we're terming fibromyalgia today, there is an awfully strong chance that you have this post-traumatic stress syndrome. If you have it, until you get that under control, you are not getting any long-term results from anything that you do. At least that's been our observation. So if you have any questions on that, feel free to fire away. Send it to us at powerhealthtalk.com or
our Facebook page.
And we'll do our best to get some sort of an answer back to you. All right.
Thank you for watching.
Yep. See you next week.